Hey everybody, I'm Tiffany North. I'm an RN, integrative nurse coach, and I help people heal their relationship with food and body using attachment theory. One of the things that is so challenging for my clients is that it's so difficult to find providers who are size inclusive and who are going to give them quality care. It's like total pet peeve of mine. So today I'm here with one of my friends, Dr. Jenny Talbert, who's a health at every size chiropractor in Portland. I just so appreciate your compassion, your care for people, your approach, the way that you think about this. So I'd love to hear, what are some of the ways that you incorporate health at every size into your practice? What are some of the frustrations you have? What have you heard from people about their experience trying to get care?
Thank you so much. So I feel so lucky that I have found the community, that health at every size community, because before I was in the regular medical model of weight-centric care, back when I first started practice, it always felt disingenuous because I've always lived in a larger body. So talking to people about trying to make themselves smaller while I myself couldn't do it either, it always felt like this disconnect. So being able to change my whole avenue and my whole direction of practice about 8 to 9 years ago and offer care that was both evidence-based and compassionate, one, it made my patients so much more relaxed and comfortable, right? They know coming into my office that there's not going to be any talk about weight loss, nothing about their size of their body creating pain or causing the problem. And they deserve and they will get the best care in the body they have right now. And so
that is what they deserve, right?
Yeah.
Like just as you are, you deserve all the care.
Yep. And I feel it's created this very safe space for people to be in and able to tell me things they wouldn't normally say. And having a relationship with coaches and other providers that are doing something similar is really the key, because we can all work together, right?
Yeah. What are some of the things, like when someone first comes to you?
Yeah.
What do they say to you about like other people, how they like?
Oh my.
Yeah.
Right. I get a lot of people describing their offhand comments from other providers. Let's say, for example, I have a patient that went to another chiropractor, and the first thing they said is, well, your back pain would feel better if you lost weight. And that just drives me nuts, because do they look at the other patients in their practice and see, oh, they are also smaller and they also have back pain? Like, come on.
Yeah, like, everybody gets back pain, unfortunately. Like at some point, right? So regardless of your size.
That's something I hear a lot. Or someone will say, oh, you're difficult to adjust. Yeah. Or I can't feel this muscle as well. And that's a problem.
Yeah, I mean, it's wild because like it's your job to know how to adjust people. So like, if
all people,
if you're with someone who's got a larger body, who's fat, who's got, more fat tissue, like you need to be able to like adjust your technique to work for their body.
Yes.
And it's such a pet peeve of mine. Like, it's our job as the providers to get better at caring for people, especially if you consider, like, thinking about like US women's sizes, the majority of women are like a size 14, 16 or above, right? And so like, it's not like we're the outliers here.
It's not a special population.
No, it's not a special population.
No. So since I have, of course, a different time frame and shorter periods of time seeing patients, you as a coach are spending so much more time. So you can really see this impact of the anti-fat bias that I see these glimmers of, or people tell me about. So what are your experiences? What have you noticed?
Oh, I mean, so first of all, most of my clients either don't have a provider or they have one that they really don't love, but they are like, well, I've been going to this person forever. I'm just going to stay with them because, I'm afraid to go to someone new. Or they don't have a doctor. They haven't been to a doctor and they're terrified of it. And it takes us months, sometimes like a year, before they're like finally feeling confident in themselves. They've worked through the medical trauma. They feel like they know how to advocate for themselves. They feel like if they are told they need to lose weight, that they can not go into a complete spiral about that. So just even all the medical trauma, all of the sort of preoccupation and anxiety and then avoidance that comes out of being exposed to, all these messages and sort of being shamed every time they go to the doctor, whether it's like for a sprained ankle or like
strep throat, anything, and you're like getting
ridiculous.
Blamed. Yeah.
So it's definitely, it has a huge impact there. It creates healthcare avoidance. And it ultimately makes their health worse because it increases the stress. The allostatic load, which is the stress and wear and tear in your body, is increased from experiencing anti-fat bias and weight stigma. And then also, like, they put off
The delay
addressing,
of care, right?
yeah, whatever is coming up. And so then whatever the conditions that they might have or challenges they might have, like, those really progressed by the time they see someone. So yeah, I mean, just so impactful in your relationship with yourself, with your community, with just your sense of safety.
Right. And that all is part of our health, right? If we think about
huge.
The whole gamut of, from the social determinants of health to our genetics to our everything that we're exposed to. There's lots of studies that show just having this anti-fat bias, like the all the things you're describing, the delay of care, the not getting the appropriate care quick enough at the right time, is all going to impact your overall health. And health is not something everybody gets. And that's the other thing too. I think we probably both have to deal with that piece of it, is making sure that people are just getting something, they can address what they need to address when they can, right?
Totally. Okay, so now we've talked about like how terrible it is. I'm wondering like what you do specifically to help people feel more safe, to give people that access, to really bring the size inclusivity into practice.
That's a great question. It definitely starts with your website, the environment of your office, your paperwork, all of the infrastructure of your office. Is it inviting for people? Do you have chairs that don't have arms, or that are wide enough or high enough or low enough to be able to have people be in your office, right? And for chiropractic specifically, do you have a table that can accommodate higher weights to maybe drop the belly piece, abdominal piece down to make it more comfortable? The physical environment is a really big part, because when people feel safe to be on the equipment or around the equipment, then that opens up the opportunity to be able to be more trusting and tell me what's happening and things like that. And I used to feel that since I'm in a larger body, people were judging me somehow about, you must not follow health advice or something. But honestly, people feel more comfortable when they see me. They know, especially as I start speaking to them and saying that's not your fault, not your fault that your body is this way and stuff like that. They see me and they trust me, right? I think so. The physical environment plus the words that I'm using, plus just making sure that I am giving the evidence-based care for that ankle pain, that knee pain, that matches up with the same evidence that I would give anyone, but tailoring it to that person. Maybe there's some mobility issues or there's some deconditioning. We can work around all of those things. So I think you have to be creative as a provider, especially a hands-on provider like myself, in modifying your technique of adjusting, your muscle work, your exercises, to make sure that it really does fit the population that you're seeing. If all you saw in school and in clinic was 20-something athletic men and women, that's not what you see in real life, right? So I think that's something that I feel really good about, that I can incorporate all of those pieces.
I love that. So no gatekeeping, using language that is inclusive and helps you feel safe, setting up your environment in a way. Like, I can tell you, there's definitely been times where like I've been going to a massage therapist or something, and I go to get on the table, and I'm like, ooh, what is the like capacity of this table? Like, I don't know, it feels a little wobbly. Like, should I ask them? Should I chance it? Like, I don't want to fall over. So nerve-wracking,
and so
right?
People they don't get the care they need because they're afraid of that. So and I think one thing people forget about is making sure that information is available for people, like on your website, on the phone, your front desk knows. You have videos of people and things like that. So that's something that I'm really wanting to focus on in the future, is how to get the information that we both know out to more, especially hands-on providers, because of course that's what I specialize in. So that's something I'm really excited about for the future.
Yeah, same. I just want this to be accessible. I want quality healthcare to just be accessible to people in all bodies, regardless. Yeah, so let's talk a little bit about that. So what are some of the ways that we can encourage people to advocate for themselves and getting the care that they need and deserve? Maybe some hallmarks of like how you can kind of tell if somebody's going to be good.
Oh, that's a good question. So there's probably some things I'll ask you about this too, because I think for sure, if the provider you're going to see, their website is full of weight loss and metabolic health things, maybe that's not the right fit for you.
Yeah.
But sometimes we don't have a choice in where we go. Insurance is what it is. But I think having a script and advocating for yourself as a patient in the office, do you want to be weighed that day? Do you not? Like having some words, and maybe you can say a few things that what some scripts you give folks for that.
Mm-hmm.
But knowing that you can ask for exactly what you want, and if you're not getting it, you can have the doctor document that they're not giving you that.
Oh,
right?
I love that.
Yes.
Yeah, good suggestion.
And really sometimes bringing an advocate with you or someone over the phone.
Mm-hmm.
Those are things that you can do. So what do you usually tell people if they're going into these situations? How are you coaching them to manage?
One of the things I've seen and really like is asking the doctor, like, what is the care that you would give somebody who's in a thin body, you know? Or like, if I didn't lose weight, what is the care? Like, if I wasn't going to pursue weight loss, like, what's the care that you would give me? What's next? And like, can I have that care now?
Right.
And if they say no, then have them document it. Another is, so for example, often people will say like, well, you can't have surgery until you're at this certain BMI, which we all know the BMI is bogus and it's bullshit that people don't get this care, right? But one of the things that I think about a lot is like, yes, studies show that people at a lower weight have better outcomes, but is this because of a lack of proficiency on my body size, or is this more bias, or is this, and then even if it was due to my size, is there actually research that shows that if I suddenly lose a bunch of weight or 10 pounds or whatever ridiculous, like sometimes they want you to lose like
10%
something
5%,
very small,
3%.
Are there studies that actually show that this is going to make a difference in my outcomes? Because being undernourished as you go into surgery is like not great, right? So I encourage people to think critically and ask questions of the providers that really get the provider thinking about their own biases and like a lack of proficiency at caring for them. In terms of like weight, I just let people know like, you can refuse to be weighed unless it's something to do with, you're on a diuretic or you have heart failure or you need to get medications that specifically are dosed to weight, which most aren't. No. Then, I would encourage somebody to just be able to say like, no, thank you. Yeah. If the person is persistent, like the medical assistant or whoever's weighing you, you can say like, please write patient refuses. Yeah. Write that in the chart. I'm happy for you to write that in the chart.
I do not consent.
I refuse.
Yes.
And even if you need to be weighed for your medication or whatever, you can try to do like a blind weight situation, but know that that's going to be in your chart. So you probably will see it in your paperwork. So I encourage people to get support. I loved your idea for the advocacy piece because providers are often a lot nicer if they know someone's in the room with you. Yeah. Whether that person's thin or not, but it's tragic. And, I just want people to really know that you deserve quality care regardless of your size. If someone's not willing to give it to you, ideally we'll find someone else. But if not, at least having that mindset and really advocating for yourself and then having people that you follow up with after where you can just be like a puddle and be sad and, really recognize like these systems suck and like you don't deserve this care. And so recognizing like the game is rigged and it's important to name that and not take it on, not internalize it as there's something wrong with you.
I think we're so lucky being in Portland. Yeah. Because I've lived in other places. You've lived in other places. Even in Portland. But we have Facebook groups and providers that have banded together and we have more options, but it is still a luck of the draw of what you're going to get when you walk into someone's office, unless you've had this vetted service, and I think that's why we rely on our fat community is we have asked a lot of questions and ask a lot of what was your experience like, and knowing that if it's in your means to get a second opinion on something, that's your right too, right? Totally. And so I think sometimes people, especially if you waited a very long time to get into somewhere and then you had a really terrible situation, you may not have time to wait, but if you do, sometimes getting a second opinion and trying again. But we know that the larger your body size is, the more stigma that you're going to experience, the more intersectionality that you have. Totally. Right? Your color of your skin, your ethnic background, whatever it might be, there's going to be so many gender expression, all of these things are going to be, we could go on.
Right. They all impact that. And so, definitely naming the systems, reaching out for community support. There are definitely Facebook groups that, are for fat folks that people will tell you in those groups, don't go to Dr. So-and-so, like that was rough, or, this doctor and that doctor. There's also on the Health at Every Size listing for providers on ASDA. Yeah.
A few people have developed their own, but we need more. I think that is not enough across the country. We have little pockets, but I think it's something that the whole country and world, world at large need to be, we just need to have more and more resources.
Yeah.
A lot of it is, hey, North, how was that experience with that endocrinologist?
Asking individuals, but also if you find a provider who is health at every size, they will know at least, some other resources in the community. And so asking them, and then like Jenny was saying, I think, really looking at like, what is someone's website like? What's their office environment like? When you call, like, does the staff know like the table weight? It's not always gonna filter either way. But another thing you can do is just like right up front, be like, hey, I'm not going to discuss weight loss. I'm not going to discuss my diet. Like I have people that that I help people on my healthcare team that I talk about things like nutrition with. And that's not what I'm here for. Just saying to the provider, like, okay, well, I'm here to discuss this issue and not these other things. Letting people know up front, like if you have a history of eating disorders, reminding a provider, like it puts me at risk if you are suggesting restrictive diets and I have an eating disorder. Trying to be proactive in those ways can sometimes be really helpful. And other clues for providers, how to find providers or when to know, how to know a provider is going to be a good fit.
Oh gosh, I think we named most of them for sure. I find that if the provider is also fat, you have a pretty good chance that at least they understand some. If they're also in an active weight loss journey or something, that's a little trickier. But I always kind of like look through the list, be like, okay, I think, I'm not trying to judge from the inside, but I think she might be a little bit better, to at least have some shared experience and shared empathy for just what we have to experience in healthcare and as a provider and a patient.
Yeah, and just even awareness of like table weights, that kind of thing.
Right?
Yeah.
Definitely.
Well, I'm so glad we had a chance to chat today.
Me too.
Thank you
lovely.
so much.
Thank you. I had to check like halfway in because I was like, did it work? Yes.